So do we see it on Facebook Live now? Okay. So we're going to get started. Thank you, everyone, for your patience as we are live now on Facebook. Good morning. My name is Jessica Delgado. I am a coordinator at the ADAPT Coalition, Family Connections ADAPT Coalition. And I want to welcome you today, this morning, for our day 2 of our Interfaith Symposium, Adapting to COVID-19, Spirituality and Wellness. Today, we're going to have Kelly Sachter from Family Connections presenting on preventing adverse childhood experiences during COVID-19. So just a little bit about us for those that may not know who we are. We are a substance abuse prevention coalition dedicated to reducing substance abuse and improving overall health for all residents in Essex County. One of our committees is the Interfaith Committee, and they plan this annual symposium and also our quarterly trainings to empower faith-based leaders of Essex County to understand and engage in issues affecting overall wellness in their communities. Our chairperson is Gwinnett Curry, our vice chairperson is Michael Doherty, and our secretary is Demetricia Barnes. So just some few housekeeping items. All participant audio and video are turned off during the presentation. However, please use the Q&A box on your screen to ask the presenter any questions you may have. You can use the chat box to chat between other participants, but we do ask any questions that you do have to put it in the Q&A so it's easier for us to respond to those questions. All our webinars are recorded and available on our ADAPT YouTube channel at Essex Adapt. At the end of this presentation, you'll be sent an evaluation will pop up at the end. If you could just complete that, it's just a few questions, 5 minutes or less. And also, we are having a raffle at the end of our symposium. This is day 2. We have 4 days of our symposium. On October 29th, we will have a drawing for some prizes for some restaurants at the end of the symposium. You will receive 2 entries for each webinar you attend and 5 entries for attending our resource fair on the last day. Okay, so with further ado, I'd like to introduce Kelly Sachter. She is our Director of Programs at Family Connections, and she has been providing services for families and children in New Jersey, providing information and presentations on topics on child welfare, visitation, supportive housing, and trauma at national organizations such as the Annie E. Casey Foundation, the Child Welfare League of America, and Supervised Visitation Network. Kelly is dedicated to partnering with stakeholders in the child welfare system to ensure that families can heal and repair from the trauma that has occurred in their lives. Kelly is also invested in bringing the latest research and evidence-based and informed practice into the supervised visitation field to ensure the most quality services are provided. So without further ado, I'm going to present Kelly Sachter.
Thank you, Jessica. And thank you, Gwinnett, Joelle, for having me today. I'm really looking forward to being able to talk with you all that are invisible to me right now in this training. But as Jessica said, if you have any questions that come up, feel free to put them in the Q&A in the chat box. What I'd like to start off with is a brief poll. So I'm going to launch it. I just want to know, in terms of who's in the room right now, your current knowledge of the ACE study. So I'm launching the poll now. If you could see it, please just put your vote in, whether you utilize it regularly in your work with others, whether you've attended trainings about it, if you're somewhat familiar with it, or you've never heard of it before. And I see the numbers coming in. Thank you, everyone. We have 10 out of 21, 13 out of 21, 15 out of 21, 76% voted. Keep it going. We're at 85%. All right, we have 18 out of 21. Okay, so 90%, we have 2 more people. If you could put in your votes, just so I just have a little awareness, but it seems like we are kind of slowing down with the voting. So I am going to 20 out of 22. Can we get 100% voting? Okay, I'm going to end the polling now. I hope this is not indicative of what happens with the poll, making sure that you mail in your vote or go to the polls for election day. I want 100% of you voting this year, just like, so let's do that. I'm gonna end the polling for now though. Okay, so it looks like 35% of you have never heard of it, so I will talk a little bit about what it is. 30% somewhat familiar, and 30% have attended trainings, and then one of you that uses it regularly. Okay, so let me share my screen now. Sound. All right, and hopefully there will not be any technical difficulties during this. If there are, please bear with me. So I'm here today to talk about preventing adverse childhood experiences during COVID-19. So the first thing that I'll talk about is what the ACE study is. So the ACE study was originally occurred between 1995 and 1997, and over 10,000 people were interviewed in terms of what their experiences were as a child, and it was looking at their experiences and how that's related to their development, how it influenced their development both physically, emotionally, and potentially caused, what they found was that it caused early death. So I'm going to talk about what adverse childhood experiences are and how it impacts the social, emotional, and cognitive impairment. So depending on the more adverse childhood experiences that you have, the more it can impact your ability to develop socially, so being able to interact with others, emotionally, being able to regulate your emotions, as well as cognitively, so how you process information. That it continues to go up if you are then have impairments with your social, emotional, and cognitive impairments. Then that can lead to adoption of health risk behaviors. So that can include substance use, promiscuity, a lot of different things that could put your health at risk. They also found that the more adverse child experiences you have, the more that you are can experience disease, disability, and social problems. And ultimately, this can lead to early death. So the more adverse childhood experiences, the earlier, looking through the whole life, the earlier that you could die. So this 70-30 campaign slide, I think, is really helpful in just kind of talking about what an adverse childhood experience is, or what they are, I should say. And adverse childhood experiences are traumatic events that can have negative lasting effects on health and well-being. And there are three categories to what an adverse childhood experience is. There's the abuse category. So if as a child you experienced either emotional abuse, physical abuse, or sexual abuse, if you experience all three of those as a child, you now have an ACE score of 3. So it's not about the amount of times that you experience physical abuse. If you've experienced it, that's an ACE score of 1. And if you've experienced all 3, you have an ACE score of 3. It also looks at neglect. So other than actual emotional, physical, and sexual abuse, it looks at the emotional neglect and physical neglect that you could have experienced as a child. The third category is any sort of household challenges. So if you grew up in a household that had domestic violence, that's another point for your ACE score. If you lived in a household where one or both of your parents struggled with substance abuse or mental illness, if you lived in a household where your parents were separated or divorced, or if you lived in a household where one or both of your parents were incarcerated. So that's what determines your ACE score. So someone could have an ACE score of 10. Someone could have an ACE score of 0. And what they found, so during this study, which started between 1995 and 1997, but has really continued. It started in California at Kaiser Permanente. The CDC then partnered with Kaiser Permanente, and now it has continued to go on. So it started with the initial 10,000 people. At this point, I don't even know how many people have been studied in terms of looking at ACE score. But what they have found are some really significant impacts. So the more adverse childhood experiences you have, the earlier your death can be. That's the ultimate ending to this thing. They found that people with an ACE score of 6 or more can die 20 years earlier than those who have an ACE score of 0. It's also very common for people to have ACE scores. 1/8 of the population has more than 4 ACEs. So we know that children, when we're growing up, we go through adverse experiences, and that can impact our health, our social development, our behaviors, and in the long run. They also found that a big number that makes a difference is having 4 or more ACEs. So if you have 4 or more ACEs, they found that those who have 4 or more ACEs are 11 times more likely to use intravenous drugs, to use IV drugs. It increases the number of suicide attempts by 14%. These statistics are really, you don't see them a lot in many studies, how closely correlated these statistics are. So this is the bad news, right? One of the things that is really important is that we're aware of ACEs, because this is the quote that's up there is, this is the single greatest unaddressed public health threat facing our nation today. So if we are able to be aware of it and address it, then we're able to take away the biggest threat to our nation. So how does trauma actually affect individuals and families? So how does that ACE score lead to all these negative impacts? What we know is that when trauma occurs for someone, so when someone experiences an adverse childhood experience when they're younger, they start to pick up different behaviors. They pick up when a trauma occurs, the fight, flight, freeze response goes into effect, and we'll talk about that. So the danger is when that fight, flight, or freeze response can help the person to survive that trauma, but it's when they get stuck in that flight, fight, or freeze as an adaptation to what they experience that then it can turn into negative behavioral symptoms. We also know that trauma affects both the body and brain development. So trauma, as you saw in the study, can affect what's going on internally for your body. There's an increased risk of heart disease, of cancers, of a lot of different things that happen internally when you're holding on to that stress and trauma within your body. It also affects your ability for your brain to process information. So when you're constantly stuck in a place of trauma, then your brain is stuck in the survival mode and is not able to access your prefrontal cortex to actually start to problem solve and do things to think about consequences. So it affects your brain development in that way. Trauma also affects attachment. So as you saw with the adverse childhood experiences, all these things are pretty much what was happening in the household. So if you have a parent that, if you grew up with a parent that struggled with mental health issues, that struggled with substance abuse, that can impact, and maybe they were not able to fully meet your needs as you were growing up, so it led to some neglect. That could affect your attachment not only with that parent, but also go on to affect attachment with others in the future. And then also trauma affects your worldview. So if your home is unsafe, then that gets attributed to the whole world as my home is unsafe, therefore the world is unsafe. Or I don't feel like I'm being cared for and loved at home, therefore the world can't love and care for me. So this is just a little graphic about the body as a learning system that shows how the importance of a behavioral reaction to trauma that can actually lead to survival. So as you can see, there's a lion, there are 3 responses that people are having in this incident when a lion's coming towards them. There's the ability to either fight that lion. There's the one person that is, so there's a fighter, there's a person that's freezing, so they're in that freeze response, and then there's this person over here who's fleeing. So that is a natural body's reaction to escaping a traumatic event, or to surviving a traumatic event, I should say. So it's a fight, flight, or freeze response. Just a little brief story that some of you might have already heard if you've attended one of my trainings before, but I think it really speaks to how much we don't know what we're going to do when we encounter trauma. When I was in my early 20s and I was living in New York City, we had, I wasn't home on this particular night, but there was an intruder that came into our apartment. So he broke into the apartment and was screaming and yelling and banging on walls. Now, the way my apartment was set up was, it was a 4-bedroom apartment. I had 3 other roommates. And when you walked in, there were two bedrooms to the right, and there were 2 bedrooms to the left. My first roommate in the bedroom to the left had the flight response. So she immediately got up and ran out of that apartment. Another roommate had the freeze response, and she's still able to talk about this, that she was sitting in her bed and she was so frozen in hearing what was occurring outside that she wasn't even able to reach over to grab her cell phone to call 911. She was just frozen. She wasn't able to talk, to scream, to move, to do anything. My other roommate, who was in the other bedroom to the right, which is where the intruder actually ended up going into, responded in the way that she could survive in that moment, and that was by fighting the intruder. She fought him so bad that she actually used her cell phone to hit him, that she knocked him out. They were all able to get out of the apartment, call the police. And I do wonder about how the intruder's traumatic response was to all of a sudden getting beaten up by this little skinny 20-year-old. And what we later found out was that this intruder, he was not there to hurt anyone. He actually, it was someone that struggled with substance use, and he thought he was in going into his boyfriend's apartment, which was on the next floor. What he was yelling and shouting about was that his boyfriend had his dog, and he was looking for his dog. He was not sober, and so he was very confused, and all of a sudden is being beaten up by this girl that he doesn't know why is in his boyfriend's apartment. The moral of the story is basically all 3 of my roommates had a different response, a fight, flight, and freeze response to a traumatic event. And so the good news is they were able to get therapy. It was a one-time occurrence, and they were able to move forward without getting stuck in that fight, flight, or freeze response. The danger is when someone is not able to get help after a traumatic response or a traumatic event, or when that traumatic event is not just a one-time occurrence, but more pervasive, as something that a child is growing up in a household where that lion is maybe their mom's abusive partner, who they don't know, is he, do I need to fight him today? Do I need to freeze today? Do I need to run away to keep myself safe, to keep my siblings safe, to keep my mother safe? Then they're stuck, that child is stuck in a constant alarm system of having to survive and protect, and that's where it affects the other parts of their body. So COVID-19. So now on top of all the other stuff that we have going on, all the other things that we know our children are living with every single day, there's COVID-19. And so this is really looking at COVID-19 as potentially another adverse childhood experience. So this is a quote from Dr. Cow, who is a professor in the Department of Pediatrics. And sorry, my screen is not showing correctly. But what he talks about is that COVID-19 is not a past trauma. This is a current trauma, and it's a preventable trauma. So right now, we could be helping families prevent ACEs because the trauma is currently happening. So we need to look at what is happening right now and how do we intervene in this moment to make sure that COVID-19 doesn't get added to the list of ACE scores for the kids that we're working with, the children that become adults, where it affects their health 20 years down the line. Dr. Cow talks about how right now, because of the decrease in doctor's visits, because people don't want to go to a doctor for preventive care, that's actually reducing the amount of screening that we're able to do for ACEs. And this in itself is a disservice to those who could benefit from the resources, from advice, from care that they need during a pandemic. Right now, we can't stop COVID, but we can protect children from the effects of this trauma. And so this is really what we want to look at today. We know that ACEs are exacerbated by social isolation. We're going to talk a little bit about the preventive factors. We know that ACEs are affected by job loss, by school closures, and other stressors that are occurring from the pandemic. So we also know that the parents right now are having increased anxiety about, wondering what's going to happen with their financial situation, having anxiety about the fact that their children might be home with them while they're not able to work. There's been an increase in substance use and alcohol use during the pandemic for people trying to cope in the ways that they know how to cope. There's also been a decrease in child abuse reporting that's occurred since the pandemic started. And this does not mean that there's actually a decrease in child abuse. When schools close, schools are a huge resource to see what's going on with kids every single day. And so when schools are closed, then we're not seeing what's happening with children. And so there's been less reporting because of that. So that doesn't mean that child abuse is not occurring. It just means it's not being reported. Also looking at, there are some limitations to the ACE study. And one of the things in doing some research for this presentation, I was actually very surprised to see some things that I haven't seen talked about the ACE study. Some of the limitations to the ACE study is that those 10,000 people that were studied, 75% of the people studied were white, and they were also college educated. So while this study is really important and it showed these really important correlations, it really did not take into effect the additional stressors that can be occurring because of racial discrimination that occurs in this country. So one thing that we look at Family Connections is not just the COVID-19 pandemic, but the syndemic that has been occurring. If you haven't heard of a syndemic is characterized by the biological and social interactions between multiple conditions and states. And these interactions can actually increase a person's susceptibility to harm or worsen health conditions. So the hallmark of a syndemic is the presence of two or more pathological states that are interacting adversely with each other and affect the mutual courses of each disease trajectory. So when we look right now at COVID-19, but then also the disproportionate, how much it disproportionately affects low-income individuals, communities of colors, we're already at increased risk of ACEs due to the historical, systemic, and pervasive racism that exists, then that's where the syndemic can really lead to more negative outcomes. As of May of 2020, only 26 states were reporting on COVID deaths in relation, looking at race and how that impacts COVID deaths. Only 2 states were looking at race and whether someone tested positive or negative for COVID. So what we need to think about is what can we do to really make sure that we are looking at the impact of not just those 10 ACE adverse child experiences, but also the impact of COVID-19 and the stressors and the trauma, the ongoing trauma of the social isolation, of the financial impact of COVID-19, but also the syndemic pervasive racism that's happening in this country. Another place that's limited to the ACE study is really how poverty, police and community violence, financial insecurity, and discrimination affect someone's score. How does exposure to the syndemic or other natural or human disasters affect someone's ACE score? That's something that we don't know in terms of these. So those are some of the things about the ACE study that that's a little background about the ACE study, but also some places where research still needs to go. But what we want to look at today is how do we combat all of that? And part of it is looking at resilience. So I have a little video here that we're going to play, and hopefully, I guess, Jessica, if you could give me a thumbs up, or Gwenera, if it's working once I press play. Here we go. You can hear it.
Resilience is the result of a highly interactive process between individual characteristics in the person and the environment in which that individual has developed.
It's really the counterbalancing of difficult things that may exist in the child's life with positive things that occur within the family, but even positive things that may exist in the community.
The easy way of thinking about resilience is like a scale with a fulcrum in the middle of it. And there are things on both sides of that scale, experiences of both bad things or good things.
Our genes shape where the fulcrum is positioned at the start.
There are certain genes that make a child more sensitive to the effects of maltreatment or parental neglect or witnessing violence.
The fulcrum may start out kind of more towards one side or more towards the other side, and that's going to make a big difference in terms of how much these subsequent events affect things positively or negatively.
Sorry.
Science tells us that experience moves the fulcrum, for better or for worse.
Even though we are born with genes, genes will respond differently to certain environmental situations as opposed to others.
What the genes are actually doing are turning up or turning down the expression of chemicals in circuits in the brain and the circuitry in the entire body that govern our responses to stress, to anxiety, to depressive symptoms.
When positive experiences accumulate and children learn coping skills that help them to manage stress, the fulcrum can slide, so the scale tilts toward positive outcomes more easily. That's what resilience is all about.
There's always an adult, or more than one adult, who is key to providing that relationship that helps to build resilience.
So that's a positive, is that we know that and one of a great presentation I heard once was someone that was talking about they had an ACE score of, I believe it was 6. So they had experienced all these adverse childhood experiences when they were growing up. But one thing that stuck with me is she said, but I am not my ACE score. I am not going to be defined by my ACE score. So it's not just about what happened to me, it's also about, in a negative way, but it's also what did I have that helped me to survive and helped me to grow and flourish. So when we look at, so these graphics really talk about specifically when we're looking at that fulcrum and looking at resiliency that our children have, or even what ourselves have. There is, it's looking at what we could do to try to help our families to make sure that those positive outcomes are the ones that move forward. So on the left, you'll see the fulcrum is a little bit shifted to the right. So so this is someone that maybe has experienced some negative things in their life. Maybe they've experienced some poverty. They maybe don't have all the different social skills to get through what they've experienced. And now with COVID-19, they're facing job loss, a loved one that has COVID. They're struggling with the physical distancing that's taking away their supports from them. Their children are home with them, their schools are closed. And so all of a sudden the balance starts shifting to that negative, right? The positive incomes, or the positive side of things, is maybe they've applied for unemployment benefits. Maybe they're in a relationship that's very responsive, that they have stable housing. So that's where it's keeping the balance from completely going over. That's where the positive resiliency is. So what we want to do as working with families and being available for families is look at how can we, so if you see in the other graphic next to it, how can we reduce those sources of stress? How can we, 2, support responsive relationships? And 3, strengthen those core life skills, so strengthen that fulcrum. So maybe something that we could do in reducing the sources of stress is looking at can schools be opened? What can we do to safely open schools so that way they, you know, the job loss is not an issue, that mom and dad can go back to work. So that could start to reduce the negative outcomes. What can we do to increase the supportive responsive relationships, really exploring who are the people that are in your corner when you're struggling with those stressful situations. And then 3 is really strengthening those core life skills. So what services can we put in for this family? What things can we do for the child at school, whether it's, you know, getting them involved in the school-based services that luckily the governor decided to continue to fund after some advocacy that happened across the state when the commissioner was trying to take that program out of the budget. What can we do to really strengthen those core life skills so that way someone's outcomes turn to the more positive side of resiliency? So preventing ACEs, this graphic comes from the CDC. And so these are the things that they have found in general prevent ACEs. So really strengthening economic supports to families. So whether that's strengthening household financial security, looking at family-friendly work policies. One thing that that I think we've gotten in certain sectors, we've gotten better at is really looking at, you know, what can we do to support families to, so there can be a parent that's working from home while their child is homeschooling. What are the state, New Jersey has looked at, you know, what's available, as well as the federal government, what kind of financial benefits can we do, like the CARES Act, to help people to be able to survive financially during this time. Looking at changing social norms to support parents and positive parenting. So whether that's public engagement and enhancement campaigns, legislative approaches to reduce corporal punishment, providing quality care and education early in life, so preschool enrichment with family engagement, improved quality of childcare through licensing and accreditation, enhancing parenting skills to promote healthy child development, so looking at early childhood home visitation, parenting skills, and family relationship approaches. And we have started some of our in-home services again at Family Connections to really, and that never stopped. We were doing it virtually for some period of time, and now there's more in-home services again to really support families in this time where we know there are increased stressors, and we want to be able to help to increase those social skills. Intervening to lessen harms and prevent future risks, so enhancing primary care, so making sure that families go for their preventive medical appointments, behavioral parenting training programs, treatment to lessen the harms of abuse and neglect exposure, and treatment to prevent problem behavior and later involvement in violence. I see there are maybe some questions. Oh, so there's a question, are we going to get copies of the PowerPoints after the session? Yes, I'm very happy to share PowerPoints. And I think last time, Jessica, you sent it out to the attendees. Okay.
Yes, Kelly. Well, we can send it out. Mm-hmm.
Okay. So one of the things that we do at Family Connections is we utilize what's called the ARC framework. So this is a model that really looks at, we know that families have experienced trauma. As you saw with the ACE study, most people have experienced some level of adverse childhood experiences. So how can we look at a framework that our entire agency can work in that helps to support people to move forward and to not just have that ACE score define them, that trauma experience define them, but really look at it as it's something being integrated in why they're a survivor and why they have resilience. So the things that we look at are the way that the ARC framework is set up is like a house. And so with a house, you need a strong foundation. So that foundation includes engagement, psychoeducation, routines, and rituals. So that's something that we want to do for our families, is make sure that we're engaged with them, that we're providing psychoeducation, and that we're looking at different routines and rhythms that, because consistency makes people feel more safe and taken care of. So that's something that we want to do for our families. What we're going to talk about in terms of increase, and what you've heard a lot about, is really looking at how important it is to take care of the caregiver. So their caregiver affect management. So the whole attachment area is what we're going to look at in a minute. But I just want to kind of bring you back to all of these things to prevent ACEs. If you look, most of them have to do with not preventing them by working with the child, but by providing the resources and support to the parents, to the caregiver, so that way they're able to then care for the child. So caregiver affect management is one of the most, they're all important rooms, but really one of the most important rooms that we need to look at with the framework. So this is back to the 70-30 campaign, which is a really important campaign, is looking at that resiliency for our families, and the presence of protective factors can mitigate the consequences of ACEs. So similar to that CDC graphic, what we want to look at is what are the resources that are available, but also the number one thing for resilience is really having at least one positive, always available, trusted adult in the child's life. So what can we do to really strengthen their relationships with adults, strengthen the adults that are caring for children, so that way that we're able to reduce the ACEs that they experience. Caregiver affect management. So what that is, and we all could do it, not just as parents, but as providers, as everyone that's in this training is probably not just caring for themselves, but caring for someone else, whether it is a child, whether it's a parent, whether it's a friend, whether it's just being involved as a therapist, as a case manager, or just someone that is there for them, for people personally. So what we want to do is make sure that we're supporting the caregiving system. So whether that's us as caregivers or professionals, in understanding, managing, and coping our own emotional responses, so that way we're able to support the person that we're caring for. So it's that analogy where you're sitting on a airplane and you want to make sure to put your oxygen mask on before taking care of someone else. That is so important. If we're walking around gasping to breathe, then it's really impossible for us to take care of anyone else. So the benefits of caregiver affect management is that when we're taking care of ourselves, then we could effectively manage our own stresses, fears, frustrations, worries. We could access that prefrontal cortex to think logically, to problem solve. It leads to a reciprocity in relationships where we're able to, there's give and take. It's not just about giving and giving and giving until we're depleted. It's about also giving back to ourselves, so that way we're able to continue to give. We want to develop empathy, and as well as it increases independence and healthy relationships. So one of the things that that is important to do in the beginning, whether it's in the beginning of the day or as a caregiver, I found this one article in the beginning of COVID that was really helpful to me, and it was starting every single day with what's called the 3 M's. So the 3 M's are mindset, mindfulness, and movement. So if we wake up every day and we know there's a decrease in movement right now because a lot of us are working from home, our kids are home, and we're not moving around as much as we were when we would be commuting to the city or just going out to, you know, to different places that maybe are not necessarily as safe anymore. If you wake up with a negative mindset, that could kind of set the stage for your day. And then there's mindfulness, which is really important. Which is really good exercise for your mind, and there's going to be a video for that. So starting with a proper mindset, I'm going to do another little. Oh wait, can I do my survey? Here it is. I'm going to do another poll.
Is it coming up?
Yeah. Yep.
Oh, okay.
So we're going to do a brief meditation, because in order to prevent ACEs, and during COVID-19, it's about us caring for ourselves, but this is also something that we could teach to others too, that we're working with. So what we're going to do is just pick an affirmation that we're going to do for a brief meditation. So this is setting our mindset. So I'm going to launch the poll. If everyone could just look at which one they want to use. This is something that you're going to be saying to yourself during this meditation, and we'll go from there. So the 3 are: what I love about myself is my ability to, and whatever it is. I feel proud of myself when I, and then whatever that is, or I use my time and talents to help others. So if you can see the poll, you're just voting on what you're going to use during this very brief meditation. Let's set our positive mindsets. What I love about myself, I feel proud of myself, or I use my time and talents to help others. We have a lot of people so far that are using their time and talents to help others. We have 69% have voted so far. Okay, I'm going to end the polling, but you'll be able to see the answer. So you can still, if you did not vote, you can still see what you're going to use. So now I just want everyone to take a second to maybe adjust yourself in your seat so you're sitting up straight. We're just going to do 5 deep breathings. And so I'm going to walk you through that. When you breathe in, I want you to say to yourself whatever that positive affirmation is. So whether it's what I love about myself is my ability to, I feel proud of myself when or I use my time and talents to help others. Or if there's some other affirmation you want to use, that's fine too. So when you breathe in, you're going to say that affirmation to yourself internally, and then breathe out, release all the stress that you've been holding this morning. So we're going to do 5 breaths in. So let's breathe in, say your affirmation, and breathe out and release. Breathe in with your affirmation, breathe out and release. Breathe in your affirmation and breathe out and release. 2 more. Breathe in your affirmation. Breathe out and release. Breathe in your affirmation. Last one. Really feel that affirmation and breathe out and release. Okay, so now that you've set your mindset, we're going to move on to mindfulness. So there's another brief video. Oh, which one is it? Is this the right one? Okay, here we go. That is really small. Hold on.
Hey, Jonah, I'm a self-employed consultant, run my own practice, but
Sorry. Okay. Okay, I'm going to reshare. Sure, here we go. Okay, here's a little video on mindfulness.
Mindfulness animated, a fun and helpful explanation. The brain has evolved so greatly that it spends much of its time solving problems that haven't yet occurred in the future, thus leading to anxiety or panic, and mulling over events in the past, leading to depression. Often it does both all the time. The question is, how can we make our brain stop and think about only the present, the state we are in when we are in the zone or in the moment? Mindfulness is derived from the Eastern meditation, a practice for thousands of years recognized to help humans control and tame our brains. Research has shown that, among other things, meditation can help depression and anxiety, reduce stress, reduce pain, while improving concentration, and giving us more energy. Meditation has also been shown to improve relationships, increase creativity, boost immunity, and may even prolong life. The question is, how do you do this? Simple. This 3-step approach is all you need. For 15 to 25 minutes every day, number 1, sit up. Number 2, close your eyes. Number 3, concentrate on your breathing or repeat a sound or word. And each time you notice that your mind is wandering, bring your thoughts back to your breath or sound or word. And if it wanders again, just to bring it right back. Keep doing this until your 15 minutes has passed. I would use a meditation timer app on your phone or any timer. The more you do, the easier it gets. Many people notice their breathing slow during mindfulness meditation, and sometimes respiratory rates reduce dramatically, but this often confers benefits on mood and anxiety. Remember, each day will be different, and some days will be easier than others. Over time, you will notice that your mind wanders less, or that you can control it more as you begin to accept that it naturally wanders, but that you can bring it back to the thought at hand much easier. Once this happens, you will notice how much more time you have as your brain finds itself enjoying the present, the birds singing, the smell of the flowers, and the color of the leaves. And you may start noticing subtle smiles and looks from people all around you. Welcome to Inner Peace. Thank you for watching.
Okay, so that was just a little brief video on mindfulness. So again, what we want to do is to prevent ACEs, we want to be able to increase the social skills of our parents. We want to give them the resources that they have to, or increase the resources so that way they're able to increase the resilience in their children as well. So only when we've taken care of, and I talked about movement already. So only when we've taken care of our own emotional state, whether it's as a caregiver or helping our caregivers to take care of their own emotional state, can we properly attune and care for our children. And with that attuning and caring for our children, we're reducing ACEs. If you notice, a lot of those ACEs were about, could be about just parents not having the ability to properly attune. If we're able to reduce the neglect that kids are experiencing, then that could reduce their ACEs. So in being able to take care of our emotional state, we want to be able to attune. And what that means is that we're going to understand and validate the child's experiences and use those skills, use the attunement skills to help support the child's regulation. There is another video on empathy, which I love, but we don't really have too much time left. So I just everyone will get the PowerPoint and you can watch it. It's Brene Brown talking about the difference between empathy and sympathy. And so it's really about just being able to sit with someone. We know that our kids are experiencing a lot of emotions due to the pandemic. It's not just us as adults that have been impacted. Kids have been impacted in not being able to go to school, not being able to see their friends on a regular basis. My 9-year-old daughter talks all the time about how, like, I can't wait until I can hug my best friend again. And so I need to make sure that I'm caring for myself so I'm able to hear that from her. Because if I'm just focused on my own stressors of working from home, of having to deal with, a 4-year-old that is having way too much screen time right now, and not really being able to be open and empathic to what my children are going through, then I'm not helping them. Then that's neglecting their needs. So I need to also, I'm not going to solve it for them, but I could sit there with them and say, I get it. I hear you. And not I get it, because I don't get their experience. But I could sit with them and hear it and just say, yes, Addie, this is hard. This is really hard that you don't get to hug Simone right now. And one day I hope soon we will. So I'm going to end with our agency's tagline, which is where hope meets possibility. And what I think is really important to just end with is that, yes, we know that our families, we can't repair all of the impacts that their adverse childhood experience has been thus far. But what we can do is look at what can we do to really provide those resources, provide social skills, look at what positive parenting they have, or positive adults that they have in their life right now to prevent future children from having more ACEs. During COVID, there is the increased impact that people have based on experiencing the COVID. And so it's really important that we are aware of that as well, and that we think about what resources can be put into place today for knowing the social isolation, the financial impact, the stressors that the parents are feeling. And so I'll just end with a little poem. And the poem is, "The waves break, but the water is not broken. The tide beats on the shore, but the sand is not beaten. The sun sets every day with an intention to keep rising. We will keep rising despite the bruising within our bodies and souls, despite the breaks and beatings that flow in and out of the days. Like the tide and the sun, we will rise." I know that we will all rise from this pandemic, from this endemic that we're experiencing, where hope meets possibility. Thank you so much for having me.
Thank you so much, Kelly. And thank you for ending that with hope. At this point, we are all hoping, right, for a time when we can be together again and we can, better help our children and connect again. I thank you so much for your time. I don't know if I mentioned it before, but this week, today's sessions are focusing on children and families. And I just wanted to, I believe Kelly said it briefly before, but for those that joined us a little bit later, today is Purple Thursday. It's actually October is National Domestic Violence Awareness Month, and where we celebrate survivors, those that we have lost, and many advocates and community partners that work tirelessly to end the silence and spread awareness around a pandemic that has plagued us for many centuries. And today is Purple Thursday. If you can wear a purple item or have a purple item by you, to stand in solidarity, to stop the silence, and to end domestic violence. So that's why we're wearing purple today. Great presentation. At this point, we are taking any Q&As. You can put it in the Q&A box. I know there was a previous question. The presentations will be sent over after the presentation. Is there any other questions at this point for Kelly regarding the presentation? Okay. I don't see any questions here, but if you do come up with a question, you can always, send us it a little bit later. We are going to transition to our next portion of our session, our think tank session. So I'm just gonna share my screen. So, okay. So at this point, I'd like to introduce Gwinnera Curry, our Interfaith Chairperson, to lead us regarding talking a little bit more in depth about what we just, what was presented and how we can implement it into our daily lives.
Well, good morning, good mid-morning, everyone. Prior to us getting into the think tank, I so appreciate the mindfulness. And again, thank you, Kelly, for leading us with a lot of nuggets, a lot to discuss. So before we do that, can we just take a moment to kind of step outside of our sedated posture and stretch ourselves? Just take a moment to, if you are home and you want to run to your living room, run back, run upstairs, do some chair yoga, just do some stretching, just to kind of refresh yourself and get the brain working, because we really want to take what we learned today as opportunities to implement and to create change. And even though we are kind of in the midst of this pandemic, there's still much we can do. So I'm just going to pause for a minute. I'm going to quiet myself and just do a little bit of stretching, or even just if you want to do a little bit more mindfulness, this is the opportunity to do that. There's a lot of information shared, and now we want to talk about processing and implementation. So just one moment of however you would like to refresh yourself in preparation for the second leg, if you will, of our presentation display. Okay, hopefully you found that refreshing and rejuvenating. And in the midst of us having that time, we did have a question. So, Kelly, if you don't mind, I'm going to pose it to you. It was a question from Nicole. Nicole, good morning, Nicole. How can we assist clients to better advocate for themselves, especially when they're in crisis? That is a pivotal question. That is a really great question. So thank you, Nicole. I'm going to mute myself so that Kelly will have an opportunity to address that.
Sure. So I think an important thing to do in terms of helping people to advocate for themselves is to make sure that they have the information that they need. So whether it's knowledge about the resources, being able to know how to access them when we're in crisis, it often feels out of our control. And so the more psychoeducation that we can provide, the more information of resources of where to go can help someone with that in that situation. But also it's really one important thing, and when we're in crisis, is being able to take the time to stop, to breathe, to practice ahead of time when they're going to be advocating for something. So whatever role playing we could do, I think can be helpful. So that way when they go into the situation, they have the skills to advocate.
Okay, thank you so much, Kelly. Appreciate that. And I believe that was able to address the question proposed by Nicole. If you have any further questions, even as we are going into our think take discussion, please continue to place them in the Q&A as time allows, and as we progress, we'll attempt to address them within the time frame that we've established. So the first question that we want to propose to everyone is based upon the information that Kelly shared. We all are familiar with children and their adverse effects, and sometimes their inability to respond to them in the ways that we do. So this was quite helpful to understand different degrees of trauma, the ACE scores. I know in the beginning of the poll, there was a lot of individuals acknowledging that they were not familiar with this. So all that you've heard today and all that you've gained, in the chat box, if you can begin to share with us a goal that you will set walking away from this presentation to implement personally or in your individual life. You can intertwine that with family, friends, spaces and places where you may have influence. If you are don't have children but are associated with children in different ways, how will the content that you gain from this webinar this morning have an impact on you, and what will you do to create change or maybe move forward? Maybe some of this information you were aware of and it just complements what you already do. But we would love to hear that. We would love to hear that, because it's always good when we can share what we're going to do as it may empower or inspire someone else. So the floor is open. The chat box is open. Want to hear from you. 2 or 3 individual goals that you will implement as a result of the information gained in this webinar. We do have a comment from Barbara Chubb. She said, I thought very informative. Thanks. Thank you, Barbara, for that comment. I would love to hear if you can be more specific about how informative it was for you and what you may be able to implement. It may certainly guide the rest of us as we continue to contemplate and process what was shared during this webinar. We have a well done, Kelly, from Krista. Thank you, Krista. Francis Dixon said, great presentation. Loving the comments. Okay, Barbara responded. Thank you, Barbara. She said, mindfulness will help me be more available for people and children I work with. Great to hear. That is excellent. That pausing, giving that space for individuals to be more attentive and hopefully create a practice for themselves is going to certainly reduce the levels of exposure and trauma, and even as Kelly talked about, the ACE scores. Deacon Frank Ingalls indicated to have a more open ear to what is being said. We certainly know the importance of listening. Listening is invaluable in relationships. And so thank you for sharing that. I think we always need reminders of how important it is to listen. Tracy Morrison said, continue to support the faculty and staff with attending to their own 3 M's. I love the reminder of the oxygen mask. I talk about that so often. How can we help others if we are not ourselves in a place of wellness and wholeness? So reminding others to administer their own 3 M's daily is going to be transformational. I would love to believe, Tracy. So thank you for sharing that, Tracy. Michael offers, continue to take care of my mental health with the continued separation from pleasure, such as grandkids and other pleasures. So often, it's not just about the immediate generation, it can be legacy building. So what I'm hearing from you, Michael, is that you're not only looking at it from your immediate children, but you're also looking at your grandchildren and using that as part of your mental health as well. I have grandchildren as well, and so they really are good for the soul. Deborah Massey, love the presentation. I will start my day with the mindfulness meditation. We'll also offer these meditations to others. Love that. If we can take these 3 M's and share them broadly in different contexts, starting with ourselves is integral. So thank you for that. Brenda Michelle offers, this was a great reminder to continually be mindful that a lot of people I work with do have an ACE score and to look out for those fight, flight, and freeze responses. That is significant. Yes, to have a greater awareness of those around us and how they respond is going to be significant and influential in how we continue to collaborate and work with them. So good. Thank you, Brenda, for bringing that forward and a reminder for many of us. I appreciate that flight, fight, and freeze responses that we all have. And I remember Kelly even offering that in her personal experience with her roommates, how that was applicable. So it's real, and an awareness of how people respond will greatly contribute to how we continue as individuals. I like to include the information and share it with the families I work with. That's from Ana Jimenez Quinones. Thank you for that. We're looking forward to all the many tentacles of information that will be shared and how it's going to not just rest with us, but move forward. Thank you all for all of those comments. I'm going to the Q&A box now because I see there's a couple of comments there. So Jacqueline Oliver said, great information. I would like to have you present this workshop to our caregivers we serve in children's system of care. All right, so I believe at the end, Jessica usually includes contact information. You can reach out to Jessica. That will then in turn put you in touch with Kelly, or if Kelly will put up her contact information at some point, that would be great. Thank you, Jacqueline, for that. Elizabeth acknowledges, I love the presentation. I will definitely use mindfulness when doing homeschool for myself and my son. Do you have any ideas to reduce the frustration when homeschooling our children? Kelly, that is a big question. I'm just going to say that's the $1,000,000 question. And do you have the $1,000,000 answer? I'm going to pause and mute myself and allow you to take that one on, because it's not just about the children. I love it. So I'm going to wait for your pointers.
You know what? I wish I did. I think that from March until now, I've gone through various places, with good places in terms of homeschooling my own children to not. I think one of the biggest things is really having grace, and actually Krista's on here now, and I think that's one of the things that she said to me when I was in like one of my most frustrated places, and just in terms of everything that was going on, is we are all in this situation. We can't expect for our kids to be getting the best educational year that they've ever had this year. We need to have grace with ourselves that we are all doing the best we can. And I do find that sometimes doing when I'm in a place of feeling that frustration and I need to take a second to, whether it's doing some mindfulness, doing some breathing, doing some stress reducing things, I include my children in that. And so I say, guys, let's take a break. Let's take a break from school, and let's all sit together and breathe. Let's do some yoga. Let's do some movements. Let's get outside and just run around the yard for a little bit. Really being aware of our own reactions and our kids' own stresses as well. And sometimes doing some regulation together can be helpful. It's not $1 million, but it's something.
Oh no, it's $1 million. And I readily agree with a lot of what you said, because I've had to implement that. My granddaughter is at home as well, with the hybrid model. And so, yes, there have been times where I just said, just take a run around, like just go outside and get some of that energy out, because part of it is just their containment. Home is supposed to be a free space where they can kind of grow, develop without the structure of what a classroom presents. So, so thank you for those helpful tips. Thank you. And Liz, thank you for bringing up the question, because I'm sure.
Yeah, just one other thing to add to that. I think it's really important also to be aware that for those of us that are working from home and where we're sitting in meetings all day, and how hard that is for us as adults, but thinking about like even college kids, they take 2 or 3 classes each semester, if they're doing online classes. The expectation that children who are, 2nd, 3rd grade, younger, whatever, between kindergarten and senior in high school right now, expecting them to sit at a computer for this long of a time period is just, we have to give ourselves and our kids grace in that.
Yes.
It's not normal.
Thank you. No, it's so abnormal. Kelvin offered, I would like to be more diligent at taking the time to be more mindful, particularly before starting my day. And I love that you focused on that, Kelly, that at the beginning of the day, to practice the 3 M's, to kind of set the tone and kind of create the experience you want to have in that day. So thank you, Kelvin, for reminding us of that. Okay, let me switch back to the chat box. I think we have a couple more comments, and then we'll probably progress to question number 2 after this. So Tracy Morrison, to help administrators understand how ACEs impact student learning and work to revise school discipline policies and procedures that support student learning and development. Yes, I can immediately think of the benefits. I'm going to defer to Kelly if she wants to address that a little bit deeper. So it wasn't a question per se, it was a comment, but didn't know if you wanted to add something to that.
Sure. So I think this is so, in terms of ACEs, there are some school systems that have incorporated ACEs. There's a really good film, if anyone's interested in watching, called Paper Tigers, which looks at how they've been able to incorporate ACEs into a school in particular with children that had really difficult emotional and behavioral issues that were due to their own trauma as well. And so I think education is huge for school systems, because ACEs, when a child is stuck in the freeze response, then if they've experienced trauma and they're coming to school and they're kind of like disappearing in that school environment, they're not able to access their prefrontal cortex to be learning in that moment. They're just still stuck in that safety place. If there's a child that is having behavioral issues, that's getting into fights, that's being combative towards the teacher, all of a sudden this child is a problem that they just want to take care of by suspension, which does not solve any of the problem. It's really looking at like, how can we help this child to express themselves, so that way they're not stuck in the fight response. So the fight, flight, and then there are the kids that are running out of the classrooms, right? So we have kids that are doing that fight, flight, and freeze in schools. And so really it's about education for administrators, for teachers, to understand ACEs and to really start to think about like, how can we intervene differently? There's a big thing that I loved in terms of Family Connections doing our internal ARC trainings. Oftentimes schools will try to correct behavior, but instead of correction, we need to look at connection. So how can we connect better the teachers and the children, the administrators, and understanding what the child's experiences are, so that way because we know that the positive support is what leads to resilience. So how can we help connection instead of trying to correct the behavior with suspensions and things like that.
All right, thank you so much, Kelly. Thank you for that. And do you mind repeating the movie title one more time? I'm just going to put it in the chat box.
Sure, it's Paper Tigers.
Paper. Okay, everyone, I just put it in the chat box so everyone will have it and know what she's referencing. Might be a good viewing for us to participate in. Well, Kelly, we want to thank you. We are going to advance to question number 2, but do realize that there's some previous commitments you have. So we thank you for being with us this morning, and thank you for unpacking this topic, which, as we can already see from the comments and the questions, is relevant to all of us and significant to how we will continue in this process, in this pandemic, I should say. So thank you again, Kelly. And as you need to go, please do. Kelly has put her contact information in the chat box. We still have one more question to address, so her information is there. Please feel free to reach out to her regarding presentations or any follow-up questions you may have. So thank you again, Kelly. So we're going to advance to, oh, you're welcome, you're welcome. So we're going to advance to question number 2. We were just talking individually of what goals we were going to set and implement. And now we're going to talk more from a organizational standpoint based on the information, which some of you may have addressed already. But what is an organizational goal that you would like to implement, either in your faith-based organization, your house of worship, or the organization that you represent here today, whether that's professionally or personally or through volunteerism? But as a result, again, of what information was shared, what you gained through this webinar, what can you implement to experience the change that will be helpful to the community organization that you serve? And you can use either the chat box or the Q&A. I think Tracy addressed it when she talked about the administration, having greater awareness of how the ACE impacts the student learning. Kelly was very responsive at that, and thank her for that. So I'm gonna throw a question out there. So we've been talking about individuals primarily. When we think of the flight, fight, or freeze, that can happen in a faith-based organizations as well. That can happen, in professional settings as well. So having an awareness there, how would we further implement what we've learned today from this webinar to create change or be an influencer in regards to what we've gained today? Okay, perhaps we don't have any direct goals outside of those that were already shared, and we are nearing up on about the 11:20 hour. So I'm going to turn it back over to Jessica for her to conclude with other updates regarding upcoming segments and sessions and other information regarding ADAPT.
Thank you, Gwenera, and thank you, Kelly, again for the presentation, for the information, for the hope, the support. I just wanted to add something about meditation for children. There's some wonderful videos on YouTube. I know my son has used that in to help him relax. So that might be something to, to look into for your own children. So not just for us, but for them. They actually do enjoy it. It was introduced to him actually by a teacher a few years ago. So I thought that was really interesting. And there was a video about a tree, and it was just very soothing, almost like a lullaby. But so they're out there. So if you want to use something else also, in addition to getting exercise, getting outside, our children can also do some of these meditations and start on the path of clearing their minds.
And if I can add to that, Jessica, many schools are incorporating this. Again, I get to witness some of my granddaughters start to her day, and they have mindfulness so she's a hybrid again. 2 days she's in school and 3 days she's at home. And they start the day with mindfulness for the children, which I'm appreciating. So there's become a greater awareness that the necessity to help the children during this time.
That's wonderful. Okay, so just to wrap up, I have a few announcements. All of our events for ADAPT are at the link that you see there as well as on our Facebook page. We have a few events coming up actually tonight at 7 p.m. where our very own Julia Revoredo is doing a webinar in Spanish for parents and Spanish-speaking families on prescription drugs, along with the Partnership for Maternal, Child, and Health program. Watch out for next 2 weeks. We have our symposium days on the 22nd and 29th. October 20th, next Tuesday at 10 a.m., we have our Prescription Drugs Committee meeting. And October 23rd at 5 p.m., we're having our kickoff event for our Incorruptible Essex Youth Coalition as well. So this is a great opportunity to get youth ages 13 to 18 involved in advocacy and in substance abuse prevention programming. We do focus on tobacco and vaping, but we also will be working on underage drinking and prescription drugs in the future as well. So it's a great opportunity if you have any youth that might be interested in joining. They earn community service hours. We'll be having that event next Friday to kick off Red Ribbon Week. So just to recap, our last two symposium days are October 22nd, at 10 a.m., the mental health consequences of COVID-19 and physical distancing with Clara Mass Medical Center staff. And at 2 p.m., we'll have Phil McCabe talk to us about managing grief and loss. And October 29th, we will be focusing on self-care and accessing resources and support. Kelly will be joining us back again on the 29th for strategies for self-care and mindful meditation. And at 2 p.m., please come to our resource fair. We're going to have various providers in prevention, mental health, and substance use treatment available to talk to us about what their sources, their supports, and what they're doing in the community right now to service others. Okay, so you don't want to miss that. And lastly, please follow, like, and share us. We have a hashtag 2020 Interfaith Symposium. If you could post about your virtual symposium experience, take a picture of your virtual setup, or anything that you view and hear, add the hashtag 2020 Interfaith Symposium. Tag us at Essex Adapt. We are on Facebook, on Instagram, Twitter, and we have our YouTube page. If you could please subscribe. All of our sessions will be recorded, and will be put on our YouTube channel at Essex Adapt. So please subscribe to us so you don't miss any of our upcoming videos. And then we also will have other webinars and trainings and PSAs on our YouTube channel as well. So we thank you so much for attending today. Don't forget, 2 p.m. this afternoon, we will have our second session on protective factors and increasing protective factors and decreasing risk factors with our very own ADAPT manager, Joel Torres. So you don't want to miss that. There will be a survey that will appear when this webinar ends, so you can just please complete it. It's very short, and then you can let us know how we did. So we thank you so much for your time today. We hope you have a great rest of the day. Thank you.